Now for a closer look at what kind of aid is urgently needed in Gaza right now. Here's the Executive Director of Doctors Without Borders Canada, Joseph Belliveau. Mr. Belliveau, thank you so much for joining us today.
Yeah, my pleasure. Thanks for having me, Mike.
So your organization has called for basic humanity to be restored in Gaza. Can you give our audience an idea of the current situation on the ground there?
Yeah, I think I just received a message from one of my colleagues just today who described the situation on the ground in great detail. And she had this to say. She said, "The morning starts while we are already awake. We toss and turn and try to sleep for a while, but the sound of the bombardments won't allow it." And she went on to talk about how she's very scared for herself, but needs to be strong for her children. And I think this description, for me, it really indicates how this indiscriminate bombing is still ongoing. That hasn't stopped. I know we're talking a lot now about humanitarian aid and how can we get, humanitarian supplies back across the borders, which is a massive issue. I think it's also important to just remember that the indiscriminate bombing is still continuing. In the hospitals, my colleagues are telling me that there is anywhere between 800 and 1,000 injured people are still showing up every day in the hospitals. And these are hospitals that we're barely able to function anymore. We're barely able to provide a modicum of medical health care in these hospitals anymore. We've gone from a situation in those early days where we had fully staffed hospitals, MSF, Doctors Without Borders, we had 300 medical practitioners working in Gaza, supporting these health facilities. We had emergency supplies on hand. These hospitals were powered. They had water. We're very quickly now, over these last days, in a situation where it is almost untenable. It is almost impossible to continue to provide healthcare because we don't have supplies. We don't have painkillers. We don't have anesthetics. Patients are literally lined up in the hospital, these hundreds of patients, many of them needing a surgical intervention. They can't get it. When we do a surgical intervention, people are howling in pain because we have to do it without anesthetic. No water, no power. It's just untenable.
Yeah, you're describing a situation which sounds like that aid is desperately in need. How long can your teams continue to operate like this without this aid?
We're right at the edge already. And the way that my teams are describing it, these hospitals are in duress. That is a word that another colleague used earlier today. Hospitals are in duress because of this situation of working in the dark. Fuel for the generators has now run out or is just very, very little left. So you can't run dialysis machines anymore. You can't do basic procedures, even lights. Again, I mentioned the painkillers and the basic medical supplies. So how much longer can we do that? Our people are still, many of them making this sort of agonizing choice between, shall I just flee and maybe go down to the south? It's perhaps a little bit safer in the south. Bombing is still occurring, according to my colleagues. Bombing is still occurring in the south. Maybe a little bit safer down there. Maybe a little bit more hopeful that I could evacuate the country at some point. But many are choosing, and it's an impossible dilemma, many are choosing to stay behind and do what they can in these hospitals, but risking their lives to do so. You've probably heard the WHO was indicating that 19 hospitals have been struck by airstrikes now, 19, and 20 ambulances. And we can confirm, not the numbers, but we can confirm from my staff and my colleagues that indeed hospitals that we've been supporting have been hit, some of them multiple times, and ambulances. So you're risking your life to be there. And indeed, without supplies, without the lights turned back on, without more staff to come in and reinforce, how do we continue?
Yeah, and we know that we are hearing, anyways, that there are 20 trucks of aid that are expected to arrive or at least go through that Rafah crossing. Do you know exactly what is coming and how much?
No, I don't know exactly what is coming. I do know from the MSF, from the Doctors Without Borders perspective, we have teams and warehouses and logistical capacities in the region. And so we've been mobilizing those resources over the last days in the hopes or in the expectation that as soon as there's an ability to cross the border and get those supplies in, we will do so. But I think important to bear in mind, we're talking about 20 trucks. We are now facing a massive humanitarian crisis. People haven't had food. The water situation is dire. So the water situation in the hospitals means that we've got a hygiene crisis because, we're using salty or dirty water inside hospitals that are way overcrowded with injured people coming in all the time. The morgues are overflowing. You're facing a serious hygiene. So then you're talking about skin infections, diarrheal diseases that are going to come. And even in the South, we mentioned relatively safer there, also no water. So, facing dehydration. One colleague was describing to me how he had to make this choice between going and searching for water for his young children versus continuing to provide medical aid. And he had to choose the former because you have to take care of your family too. So, the 20 trucks is any amount that is allowed in and allowed to cross the border so that we can start some sort of humanitarian response now would be very welcome. But those 20 trucks are going to be a drop in the bucket.
Executive Director of Médecins Sans Frontières Canada, Joseph Belliveau, thank you so much for joining us today. We appreciate this.
Thanks for having me, Mike.